So my name is Jen Keating. I'm a lecturer at Cardiff University in the School of Social Sciences. My background is in developmental psychology and mostly in working with children with neurodevelopmental conditions. So as I started working with SAIL and with Administrative Data Research Wales, I was really interested in additional learning needs support, but also thinking about who gets support and potential inequalities and who has access to support at school, but also the sort of diagnostic assessments as well, and looking at sort of delays in children being able to access timely support, and sort of how schools might be supporting children as they're waiting for assessment as well. So this is presenting some kind of exploratory work, looking at comparing sort of the timing of receiving a diagnosis and health records, and then education support at school as well at sort of a population level in Wales. So a bit of a background. So in all of the different education policies across the UK, there's a really strong emphasis on early identification and early intervention. The idea behind this is if children's needs are identified early, they can begin their support early, that can be implemented early. Children may be more responsive to interventions if they start them earlier in their development, and it might help them kind of have less disruptions later on in their education. If they can get the support they need, they don't maybe fall behind their peers, and they can kind of continue to thrive in school throughout their education. And it might disrupt some of those later problems that might crop up if children don't have access to that support. And there is some recent research from population level cohorts, both in Wales and New Zealand, suggesting that receiving education support, like special education needs support, can reduce the likelihood of poor education outcomes for children with both neurodevelopmental conditions and mental health conditions as well. So in Wales, we've just sort of transitioned to this new additional learning needs system. This is meant to be a unified system from 0 to 25 years of education support, where every child gets an individual development plan. Because this transition has been going on for the last few years and kind of the fallout of COVID and school disruptions, the research that I'm going to be talking about today is on the older special education needs system. So I'll be using the term SEN rather than ALN just for the purposes of the data that I'm working with. So under the old system, it was more of a tiered system. So there was 3 different levels of support. So the first level being school action. So some kind of intervention that was different to sort of the mainstream education that a child was receiving. That might have been extra help with numeracy skills or literacy skills. Then children might need slightly more support. They would move to the school action plus level. And this might be some outside support. So whether they had extra support from an occupational therapist or a speech and language therapist that was slightly more intensive. And then children who had the most complex needs would generally be given this statement of needs. And this would be a legal document from the local authority outlining the sort of support that a child was entitled to get. So for some children, they would move along this as a sort of a graduated response of moving to school action, then to school action plus and to statement as well. So in terms of accessing support, both the current ALN code and the older SEN code specify that a child does not require a diagnosis in order to access any kind of education support. But receiving a diagnosis from health records, whether that's an ADHD or an autism diagnosis, for example, often can unlock access to a range of different services. And there's many real life reports from both the Senedd and the Children's Commissioner for Wales and different kind of academic and also anecdotal reports that speak about the difficulties in accessing appropriate provisions while children are awaiting assessments for maybe neurodevelopmental diagnoses. So from the Children, Young People and Education Committee, from a quote from 2024, we know that the ALN reforms are supposed to be needs-led rather than diagnosis-led, but this is clearly not happening in practice. And this is from a Senedd report from July of 2024, which is just looking at sort of the demand and the increased need for access to neurodevelopmental assessments as well. So this is looking at the number of children and young people who were waiting for an autism or an ADHD assessment between 2023 and 2022, and 2023. And we see across all of Wales, there's an 87% increase. So there's an increase in demand, but there's also an increase in sort of waiting times and children waiting longer in order to be seen by the different health boards across Wales as well. And this is what really led us to the current study, and the question we were interested in is really, if children are waiting longer and there's increased demand for children having access to these diagnostic assessments and getting their diagnosis and these supports in place, how are schools supporting them during this time? So what we're trying to map out is really comparing the timing of, say, a diagnosis and health records to when children are identified with education support in Wales, and whether there's a difference between the timing of these two. So this was our research question. Is there a difference between the timing of identification of a neurodevelopmental diagnosis in health records and then the identification of SEN provision in education records? So we created a cohort spine using the Welsh Demographic Services dataset of children born in Wales between the 1st of September 2002 and the 31st of August 2008. We then looked at primary and secondary health data sets. So we looked at the patient episode database for Wales and the Welsh Longitudinal General Practice database to extract any children who had a record of a neurodevelopmental diagnosis. I'll talk in the next slide about sort of how the different codes that we looked at. And then we also linked this with the Welsh Government Education dataset to look at pupil records and also their SEN identification. So whether they'd been identified with SEN and kind of at what age they'd been identified. So through this linkage, we ended up with a final sample of 216,271 children for this age range. And just to say that we followed them up until the end of the school year 2018-2019, just before the onset of COVID as well. So we have a slightly different amount of data for each different birth cohort as well. So in terms of what we were interested in, we looked at the health conditions that children had been identified with. And from the, say, primary and secondary health data sets, we extracted information on whether children had been identified with a neurodevelopmental condition. And for this, we use the code list of neurodevelopmental and behavioural paediatric conditions from the SAIL concept library. So this uses both READ and ICD-10 codes. And we also supplemented this with some code lists from recent research using SAIL that had looked at both autism and ADHD codes as well. We then extracted the age, or calculated the age at which a child had been first identified in their health records for each condition they'd been identified with, because some children were identified with multiple neurodevelopmental conditions. We then looked at whether a child had ever been identified with SEN across their kind of school career. We looked at the age at which they'd first been identified with SEN then as well. We also looked at the total amount of years that they'd spent receiving SEN support across their schooling, and then also the birth cohort that they belong to, because as I said, we've got slightly different years of data for the different birth cohorts as well. So of our sample of over 216,000, we found that 8,565 had been identified with neurodevelopmental conditions from their health records. The majority of these were identified with ADHD and with autism, with slightly smaller numbers being identified with conditions such as a learning disability, kind of other developmental conditions, or tic disorders as well. So of those smaller conditions, so tic disorders, speech disorders, learning disabilities, and the developmental conditions, we actually collapse these into sort of an other developmental conditions category for our analysis as well, just because we had quite small numbers for each of these groups. And this is just looking at sort of where the information was coming from. So we had over 89,000 of our samples. So can see here, over 41% of the sample had ever been identified with SEN across their academic journey. This is a range of children being identified with SEN for 1 year versus having SEN for, all of the years in which they were in compulsory schooling. But then we were sort of interested in who's being identified maybe from a GP versus from hospital records. And what we found was there's actually a really large group of children who are identified with special education needs, but did not appear in the health records. But most of the overlap that we're seeing is coming from the GPs and being identified with SEN. There was much smaller numbers who were only identified in sort of a hospital setting, who also received SEN support as well. And then in terms of our research question, so we did find that there was a significant difference. So children were identified with SEN provision significantly earlier than being identified with a neurodevelopmental condition in their health records. So the mean age of beginning your SEN support was about 6.04 years, but the mean age of first appearing with a neurodevelopmental condition in health records was 8.47 years. So there's quite a big 2.43 years in the difference. This is looking at any neurodevelopmental condition, but we also saw the same pattern when we looked at it across the different conditions. So for ADHD, for autism, for conduct disorders, and so on. But then we were interested in doing a bit of a sensitivity analysis, because when we look at the timing of say, SEN identification here, we're considering any of those 3 levels. So the school action plus, or the statement. So in our sensitivity analysis, then we wanted to look at if we just looked at the, say, more intense levels of support. So for the first sensitivity analysis, we looked at the age of identification or first identification at either the school action plus or the statement level. And we found the same pattern of results. So there's a slightly smaller mean difference between the groups. There's only 1.59 years, but we still see that children are identified with their education support in school significantly earlier than receiving or kind of first appearing with a health diagnosis in their health records. But then when we looked at the age of identification of just statements, so only children who are identified at the first age at which they're identified with statements in their education support, we actually see that this result flips around. So now we see that the mean age of health diagnosis is slightly earlier at just over 7 years, and the mean age of SEN identification is 7.68 years, so it's slightly later. So children are getting their health diagnosis on average and then beginning their statement support after. We do find this pattern is true for ADHD and for autism categories, but not true for some of those smaller categories as well. So some of the limitations of what we're working with, this is an exploratory study. So we were just kind of interested in mapping out this timing. One thing to flag is that we have a much less nuanced way of looking at SEN identification. And because we can only see children being identified with SEN in the PLASC census, we only get a yearly record of whether they have SEN or not. So we don't get the exact onset of SEN, but we're sort of approximating this from the January PLASC and their week of birth as well. So it's a much less nuanced age than we can get from the age of identification in health records, just to flag. We do have a lack of information on referrals to track when children are referred and potentially the length of time between being referred and then getting a diagnosis or having that diagnostic code appear in their health records. There is a small number of children who are identified with certain neurodevelopmental categories, which limits kind of how much we can say about them. And we had to sort of group them into one other developmental conditions category, which isn't particularly meaningful because they're all quite different conditions. And also because of sort of the disruption of the COVID-19 pandemic to schools, but also then the transition into the new ALN system, we only really have full education data for one birth cohort. So that early birth cohort of 2002 to 2003, and where we have a full kind of full education data for them up until the end of compulsory schooling. But what we think we might be seeing in this data is that children are identified with their SEN provision significantly earlier than being identified with their neurodevelopmental conditions. And it's possible that this is because they're being referred for assessment around the time that the SEN support begins, but they're not being diagnosed for several years due to waiting times of being assessed. So crucially, we don't know what kind of support is received in school. Or how effective it might be, especially because we only see this flip to receiving a statement in general after the diagnosis is received in health records. So I think what we're hoping to do is to be able to look a bit more about whether education outcomes might change when this, as children kind of receive different support, but also how the support might change once children get their diagnosis as well. So some of our current work is trying to link this data set to attainment and attendance across primary school to look at sort of the impact of both SEN identification and diagnosis timing on education outcomes as well. And that is everything from me. So thank you very much for listening. And if anyone has any thoughts or questions or anything, it would be really great to hear them. Thank you.